It's incredible. We started with bone marrow transplantation in the 70s, bone marrow transplantation, and we could transplant only the patients below 50 years of age and only if they had a match identical sibling in the family. This was bone marrow. Then we shifted to peripheral blood. We collected peripheral blood stem cells, which was much easier. Then we were using myeloablative conditioning. We switched for about 60% of the patients to reduced intensity conditioning. And this made things totally different because the non-relapse mortality rate decreased and decreased. And finally, we built a huge registry of matched unrelated donors, 50 million people all around the world, and to end up with haploidentical transplant, which appeared in the year 2010 and later. And this was developed in the US in Baltimore with the use of high-dose Cytoxan to prevent GVH, but also in China with the so-called Beijing protocol. So, just to summarize, nowadays, about 90% of the patients have a potential donor for an allogenic stem cell transplantation. I'm not mentioning autologous, but for an allogenic stem cell transplantation, everyone can be transplanted if it's wise to do so. We don't have anymore a problem of finding a donor.